Welcome to IG Academy's Introduction to the Occupational English Test. So, what is OET? The Occupational English Test is the world's only global English test developed specifically for healthcare professionals. OET assesses the English language proficiency of foreign-trained healthcare professionals who are seeking to register and practice in an English-speaking environment. It provides a valid and reliable assessment of all four language skills: listening, reading, writing, and speaking, with an emphasis on communication in healthcare settings. Who can take OET? OET tests health professionals from the following professions: dentistry, dietetics, medicine, occupational therapy, pharmacy, podiatry, radiography, speech pathology, nursing, physiotherapy, and veterinary medicine. What are the benefits of OET? Regulatory authorities, registration boards, and councils can ensure that internationally trained healthcare professionals have appropriate standards of English specific to the healthcare sector. Hospitals and other healthcare employers can ensure that their employees have the necessary English language communication skills for delivering quality healthcare. Education institutions can ensure that graduating students have employment-ready or registration-ready language skills. Because of the wide scope of OET, you should check first with your institution or regulatory body if they recognize OET before you take the test. The OET scoring system. There are many aspects to being able to communicate in a language effectively. OET therefore has 4 subtests, which are listening, reading, writing, and speaking, to acknowledge that these involve different subskills and strategies. Candidates receive a separate grade for each subtest, ranging from A, the highest, to E, the lowest score. There is no overall grade for OET. Here are the descriptions for each grade that appear on the printed statement of results that candidates receive. A means very high level of performance. B indicates high level of performance, meaning able to use English with fluency and accuracy adequate for professional needs. C or C+ is a good level of performance. However, this may not be acceptable to a range of health and medical councils. D is a moderate level of performance, which means the candidate requires improvement. E is a low level of performance, which requires considerable improvement from the candidate. You should consult your institution, professional registry, or university the score they require before you take the test. For example, in the UK, the GMC requires a score of grade B on all subtests. The NMC requires a grade B on listening, reading, and speaking, and considers a C+ on writing. Modes of delivery. First is OET on paper. This is the traditional test mode where candidates handwrite their answers for listening, reading, and writing, and complete a face-to-face speaking test with an interlocutor at the test venue. The second option is OET on computer at a test venue. This is the same OET made available to candidates who do not have access to a physical test venue in their country or have other access issues. Candidates type their answers for listening, reading, and writing while being constantly monitored by a remote proctor. The speaking test will be completed via Zoom with a live online interlocutor. Finally, The OET on computer at home. This is the same OET presented on computer. Candidates type their answers for listening, reading, and writing, and complete a live online speaking test with an interlocutor via Zoom from their home or other suitable location. Your preparation for the test will depend on which delivery mode you prefer. IG Academy advocates OET on paper as it remains the most popular and accessible test mode for many candidates. What is the focus of each subtest? For listening, candidates need to be able to show they can understand the meaning of a range of healthcare-related recordings, including patient healthcare professional consultations, workplace conversations, and conference-style presentations or interviews. For reading, candidates need to demonstrate their ability to quickly locate specific details to allow them to take action for a patient and to synthesize information from more complex texts to understand the main message or opinion being presented. The listening and reading tests are the same for all OET candidates and cover topics of general interest to all healthcare professionals. For writing, candidates need to produce a letter to another healthcare professional or person related to the patient in response to a series of case notes outlining a patient's medical condition and need for further care or treatment. For speaking, candidates complete the test with an interlocutor who takes the role of their patient or family member or carer of a patient and role-play two different but common healthcare scenarios which are presented on roll cards. The writing and speaking tests are specific to a particular candidate's profession. The OET is a rigorous and thorough test of English in the context of healthcare. Candidates who achieved the scores required by regulators demonstrated a level of language proficiency that will ensure patient safety and quality of care. IG Academy is here to support you on your OET journey.